This is the demonstration of ClinixMD for behavioral health. Today I'm going to take you through how a doctor would see a patient on a day-to-day basis. Then when I'm done showing you how simple and quick it is to document an encounter, I will then show you more features that our existing clients seem to appreciate. As a physician, I'm going to start on the patient locator. The reason why I'm going to start off on the patient locator is because it locates your patients in the office at any given time. At a quick glance, you can see your schedule of patients for today, what time they're due in, whether or not they've checked in, and what location they've been waiting in. Also, you can see how long they've been waiting in whatever location. All the locations are all customizable. Not only are the locations of the rooms customizable according to what you have in your office, but also the color coding and the time spent is also customizable. So if you don't like the fact that it moves from green to yellow to red, you can change those colors to anything that you'd like. Also, the time between the changing of colors, you also can customize as well. Now, as a physician, I can see that ClinixMD is waiting in the therapy room and has been waiting for about 8 minutes. So what I'm going to do is simply open up my encounter. Once my encounter is open, you can see here that this is where my actual documentation will go. Now, before I start the documentation, I just want to point out two things. First thing I want to point out is all these tabs on the left-hand side, you can have as many or as little tabs as you want per user, because each person in the office is going to utilize the EMR in a very different way, so you're able to go ahead and give them the tabs that they will utilize every day and also put them in whatever order you normally would work in. Also, the color of the screen is also customizable. You can select green for certain locations. You can do blues, reds, whichever color works for you. Now you can see here the tab that we're sitting on is called the progress note, and this is actually your note for this patient. Okay, so what happens is we have our past medical history in here. We also have our family history and as well as our social history. We have active medications. If you went ahead and did the DSM-4, it's in here as well, and then a signature line. Now, what's great about this is that all of these histories are all customizable. So whatever you want to have in your medical history, family history, social history that you normally ask can be actually added within this area. Now, what our doctors will normally do is now go ahead and apply their pattern. Now, before I go ahead and apply my pattern, I just want to talk a little bit about what patterns are. A pattern is basically your plan of care with all the different components that you would normally dictate for a patient who comes in who complains of a certain condition or is here for a certain type of office visit. Basically, what it will allow you to do is take any pieces of your documentation, your chief complaints, your review of systems, your exams, your plan, and take all those pieces and parts and put it together within one pattern or one plan of care for that condition. So when you apply the pattern, it applies all the different pieces to the progress note for this patient's encounter for today, and then you only have to change by exception. Now, the great thing about patterns is you can default as much or as little as you want within that pattern. You also can share patterns with other providers that you have there in your office. You also can copy patterns over and utilize those as well. So it's very flexible as to how much you want to default or not have defaulted within those patterns. You get an entire library of patterns and templates that we use in ClinixMD. Not only do you get the entire library, but we also go ahead and give you the training on how to customize, how to edit, and also create new templates and patterns so you can go ahead and utilize those within your system as well. We also do offer customization, so if you have a top 10 office visit type, we can go ahead and customize that as well. It's a little bit longer of an implementation process, but we do offer it. So that way when you actually go live, you have a good library to start with of your documentation. Now what I'm going to do is simply apply this pattern and then just watch my progress note. It's going to go ahead and load all the different components that I have within that pattern. So now it went ahead and put in my history of present illness. And again, it's defaulted for my demonstration. So again, you can have as much or as little as you want defaulted. As I scroll down, you can see my full review of systems, my psychiatric review of systems. I also have my physical exam. Diagnosis codes can be defaulted, assessments, as well as prescriptions can be defaulted within the pattern as well, and also extended treatment plans. So from here, how do you change the information that's now been defaulted into your pattern? If I wanted to change something in my review of systems, it's very easy. You just go to those corresponding tabs. So for example, in your review of systems, we have two different areas. Any systems you can go ahead and fill out. The check marks are basically just allowing you to see what is already defaulted within that pattern. And then it's very easy to go ahead and just simply select no or yes for any of the other choices. Again, since you already have certain things defaulted, if they're normals, you can go ahead and bypass those pieces. The other thing I'd like to show you is how we actually document. Within our templates, there's a lot of different ways that you can select information. And the nice thing is that, if you document a different way, if you prefer to type, you prefer to dictate, you prefer to select information, all of that can be done within our system. And I think that's the most important thing that you want to take away from this demonstration is just how flexible our system is and how many different ways you can actually document within the system. So for example, we do have drop-down lists. In all the drop-down lists that you have, we always have a new and modify list. So if your choice is not here, you can always hit new and add your choice. It'll be there from then on. We also have note boxes where you can go ahead and type in text. You can also insert text if you're using a tablet computer. We're completely compatible with Dragon Speak Medical Edition, so you can go ahead and click your cursor in, start dictating with Dragon, and it'll go ahead and dictate right in the note box. We also have something called keywords. And within the keywords, you can very easily select a phrase, a couple of keywords, one word, and it can actually expand it into sentence form, paragraph form, so that you don't actually have to type it up every single time the same way. You can just very easily select your text, and it goes ahead and imports the text right into the note box for you to modify. The other nice thing that we have within our system is within our chief complaint area, again with our templates, we again have our drop-down lists here, but then we also have other ways that you can select information. You can use checkboxes to select information. You can use integers, numbers, decimals. We also have ways for you to type in very little key phrases, little key words. And then also we have radial buttons. You also can put in calendars that fold out. So there's a lot of different ways that you can go ahead and select the information you want for your dictation. Now if you're not into drop-downs, you're not into checkboxes, even the note box might be a little small for you if you're going to dictate. We also have the option of just selecting the template, and you have an open area for you to go ahead and dictate all of your information right into this area as well. The next thing I'm going to show you is our Diagnosis tab. Our Diagnosis tab actually takes the place of that charge slip or that super bill that you would fill out. So again, you'd be able to go ahead and have your ICD codes and your CPT codes either defaulted in the pattern or as a part of the template to very easily select. We also do something very nice to kind of help with the transition into an electronic medical record, where we have an entire, all list that you can search for your diagnosis, your CPT codes. It's the entire list of all ICD and CPT codes. It's updated frequently. But then we also come in and ask for your most commonly used ICD and CPT codes, and not only the code, but also what descriptions do you normally use? What do you normally look for on your super bill? What do you normally check off? If you're already on an EHR, what do those descriptions say? And so that way we can actually create a very specific, specialized clinic list for you to be able to search for the different codes that you might need for this patient's encounter. Another thing we do is if you actually do any in-house testing, we can go ahead and get the CPT codes to attach to those procedures or to any of that in-house testing so that whenever it's added, the CPT codes get automatically added to this area. And then it's very easy to go ahead and just assign your codes. And then from here, you can very easily just send off your billing to whatever billing company that you have or billing program as long as you have that HL7 interface. Next thing I'm going to show you is our prescription tab. In our prescription tab, you can see this prescription was already defaulted within my pattern. So again, you can default your prescriptions. You can also have prescriptions in your templates, so you can very easily select from there. We have all the drug-to-drug, drug-to-disease, and drug-to-allergy interactions. We also have formularies, so if the medication's not on that patient's formulary, it'll give you a list of therapeutic alternatives that you could replace with if you so choose. Another thing we do, much like the actual ICD and CPT codes, but we also have an all list for you to search for prescriptions. The entire all list consists of the entire book of medications, including medical equipment. It's updated monthly. But then we also come in and ask for your mostly prescribed medications. Not only the milligram and the name of the medication, but also how do you normally prescribe it? Quantity, refills, are there any instructions that go along with the medication? So we create that, again, specialized clinic list for you before you go live, so it's very tailored to what you guys do in your practice, and you can very easily select the prescriptions from there. Now, obviously, you can print the prescriptions, sign them, whatever your state laws allow. But then what most people will do as well is either fax the prescription off, or they'll go ahead and e-prescribe, because we are fully compatible with e-prescribe as well. First thing that's going to come up is the patient's preferred pharmacy. What we do at the clinic as well is we come in and we ask for your zip codes in your area, and we build your entire pharmacy list for you. You also get training on how to add that pharmacy that pops up on the corner, or how to inactivate that one that goes out of business. The other thing we do in training is we train the upfront staff, or whomever you want to give responsibility, to be able to add that patient's preferred pharmacy. So instead of having to search for the pharmacy every time the patient comes back with you, you can go ahead and very easily just select the one that's already added to their preferred pharmacy. When you add it, you can see that it gives you the sender information, which is you guys. It gives you your recipient. And then you can also choose to fax it. If you, instead of e-prescribing it, you'd rather just fax it right off to the pharmacy, you can do that as well. So all you have to do is hit send, and it'll send it out. The other really nice thing about prescriptions within our system is that it keeps track of everything. Not only will it tell you if it's been faxed, printed, or e-prescribed in every corner in every prescription, but also we have a fax log and an e-prescribe log that tracks everything that is done with those prescriptions. So for example, if you e-prescribed it, you can check later on in the day in the e-prescribe log, make sure that it went successfully. But also we have our fax log, which is really nice because not only does it track the prescriptions that are being faxed out, but it also goes ahead and tracks anything else that you fax out of our system, correspondence, letters, progress notes, images. And right from there, it's very easy to go ahead and see if it's failed or if it's actually sent successfully. Also, what's nice about that is if you sent a fax off a few days ago to another doctor, and the doctor is now requesting it again because they lost it or didn't receive it, you can just go right back to that fax log, highlight that fax, and hit resend. So it saves a lot of time of having to search for information to re-fax off to another doctor's office. Last thing I'm going to do is go ahead and check this patient out because I'm done seeing them. It allows me to give their next appointment whenever they need to come back. Also, I can go ahead and send my billing off if I am ready to send the billing. I can sign off on my entire encounter if I'm ready to do that. The billing and the closing encounter are up to you guys on when you want to send billing and when you want to close the encounter. It does not have to be done at this time. You can finish up your charts later on. You can send your billing a little later on. Also, you can check out any other notes that they might need as the patient leaves your office. And so when I hit OK, my patient knows when they're due back for their next appointment. It's checked my patient out of the patient locator. You can see ClinixMD is gone now. I've gone ahead and sent my billing off. I've signed off on my note. And then at checkout, it's very easy for them to go ahead and see the patient and review any details that they might need to go ahead and take care of before the patient leaves the office. So as the doctor, I would just really move right on to my next patient. The next piece I'd like to talk about is incoming fax log. What's nice about the incoming fax log is that not only can you fax out of our system, but you also can receive all your faxes in our system. A lot of times when you go to an electronic medical record, there's a lot of scanning that occurs. Instead, what happens with the faxes is that they'll all come in electronic, be listed right here on the screen. You'll be able to review the fax. From here, you can print it, you can delete those junk faxes, or you can add it right to a patient's chart, eliminating the need for scanning. The other nice thing is that if a fax came in for a specific user and they need to go ahead and look at it before you go ahead and file it away, what you can do is actually delegate that fax to that user. And then we have a built-in messaging system within the EHR that when you delegate the incoming fax, it'll notify that user within their inbox, letting them know that they have an incoming fax. When they double-click on that message, it brings them right to this page, right to the fax that they need to look at, and then they can decide what to do with it from there. The other nice thing that we have with the incoming fax is you can actually track everything that's done with all the faxes. So for example, no more misfiling, maybe under a junior instead of a senior. What was done with the fax? Was it deleted by accident? You can run this audit log at any time, and it'll show you who did what with what fax and when, what patient was it added to. Do you need to add it to a different patient at this time? If it was deleted, do you need to add it to a patient? So it really does protect you with your incoming faxes. The next thing that I'd like to show you is how you can annotate with on images. So I'm just going to go back into a patient's encounter. going to go to my Image tab. And then what you can have are all of your consent, your HIPAA forms, your release forms, anything that the patient normally would fill out. If you want them to fill it out electronically, you can actually select that image with your tablet computer, pull up that image, hand a stylus to the patient, and have them sign directly on that form. It also allows you to draw or annotate within medical images as well. So what I'm going to show you is just how easy it is to go ahead and do that. All the descriptions here are all customizable, so whatever you guys want to file your information away in or your forms in, it's all customizable. You actually give that to us before you go live. We go ahead and build that for you. I'm just going to go ahead and select this one form just to show you how it is to annotate. And it's very easy to just go ahead and annotate. You can circle things, mark anything, have the patient sign things. And then when you save it, it saves it directly into the patient's chart for you. So now you can go ahead and print out a page to hand to the patient so that they have a copy, or you can go ahead and fax any of these images off to any other area that you might need to. And then it just saves it right in the patient's chart so you're ready to go. Okay. So that's our complete demonstration of ClinixMD for behavioral health. We do have a lot more within our system that you can utilize. If you have any questions or want to go ahead and set up a more in-depth demo, feel free to contact our salespeople. Thank you so much.